This podcast is narrated by an AI-generated version of Ravi Talwani's voice. Latest developments in feline diabetes treatment. New insulin formulations. Concentrated insulin glargine U300, an ultra-long-acting form of insulin glargine 300 UML has been studied in diabetic cats. In a trial of 13 cats, this concentrated insulin achieved safe and effective glycemic control over 8 weeks, with improvement in clinical signs and significant drops in fructosamine. Several newly diagnosed cats even went into remission. Researchers conclude that glargine U300 appears effective and well tolerated in felines, though further long-term studies are needed. This formulation creates a smaller subcutaneous depot and flatter, prolonged insulin release compared to traditional glargine, potentially offering more stable blood glucose levels. Weekly insulin analog AX267C. A once-weekly insulin therapy is an emerging concept to improve caregiver compliance. A recombinant fusion of insulin to a feline immunoglobulin fragment AX267C has an extended half-life, allowing subcutaneous injection just once per week. In a pilot study, diabetic cats previously controlled on twice-daily insulin were switched to weekly AX267C. After 7 weeks, cats maintained similar glycemic control with no significant changes in weight, fructosamine, or glucose levels, and no adverse reactions were reported. This suggests that weekly insulin dosing could become a viable option in the future, greatly reducing injection frequency while keeping diabetes managed. Alternative non-insulin therapies. SGLT2 inhibitors, new oral medications. Sodium glucose cotransporter 2 inhibitors represent a breakthrough in feline diabetes care. In late 2022 and 2023, the FDA approved 2 oral drugs, Bixacat bixagliflozin tablets and velagliflozin oral solution, brand named Synvelgo, as alternatives to insulin for diabetic cats. These once-daily medications lower blood sugar by causing the kidneys to excrete excess glucose in urine, a strategy borrowed from human type 2 diabetes treatment. Clinical experience and trials show they can control feline blood glucose about as effectively as insulin in many cases. An expert at Tufts University noted these are the first non-insulin drugs to successfully treat diabetic cats, with studies reporting over 80% effectiveness in lowering cats' blood glucose levels. However, SGLT2 inhibitors are not appropriate for every cat. They are indicated for insulin-resistant type 2-like diabetics that still produce some insulin. Cats that have previously been on insulin or are insulin deficient should not receive these drugs, as they carry a higher risk for dangerous diabetic ketoacidosis in such cases. Veterinary supervision and regular monitoring remain crucial when using SGLT2 inhibitors, but their availability offers a promising insulin-free option for newly diagnosed diabetic cats who meet the screening criteria. GLP-1 receptor agonist incretin mimetics. Another pharmacological advance under investigation is the use of glucagon-like peptide-1 GLP-1 analogs, which stimulate insulin release and improve glucose regulation in a glucose-dependent manner. Long-acting GLP-1 agonists such as exenatide and liraglutide have revolutionized human diabetes care and can induce weight loss with low risk of hypoglycemia. In cats, early studies are exploring their benefits. For example, exenatide extended release, a once-weekly GLP-1 analog injection, was tested as an adjunct to insulin therapy and a low-carb diet in diabetic cats. The pilot study found exenatide to be safe, and cat side effects were mild transient reduced appetite or vomiting in some cats, and it notably prevented weight gain seen in the placebo group. Cats receiving exenatide showed a trend toward better outcomes. About 40% achieved remission versus 20% in controls, and more achieved good glycemic control, though the differences were not statistically significant in that small sample. The authors concluded that exenatide did not harm cats and may improve remission rates by an additional till to 20%. While GLP-1 analogs are not yet standard therapy for feline diabetes, these findings are promising. Experts speculate that certain long-acting human GLP-1 formulations, weekly or monthly injections, could be adapted for cats in the future, potentially reducing the need for daily insulin if proven effective. Dietary strategies and remission. Low carbohydrate, high protein diets. Nutritional management is a cornerstone of feline diabetes care, and recent studies reinforce its importance. Cats are obligate carnivores with limited tolerance for high dietary carbohydrates, so veterinarians strongly recommend diets that are high in protein and low in carbs for diabetic cats. Feeding a protein-rich, low-carbohydrate diet, often via canned wet food, helps blunt post-meal glucose spikes and reduces the insulin demand. In practice, cats switched to low-carb diets exhibit better glycemic control and often require lower insulin doses. Clinical research shows that combining a low-carbohydrate diet with insulin therapy leads to improved blood sugar regulation and higher remission rates compared to high-carb diets. In overweight diabetic cats, controlled weight loss on a high-protein diet can improve insulin sensitivity, while underweight cats benefit from the high protein to restore lean mass. Overall, tailored feeding plans, often prescription diabetes diets, are considered a key part of treatment, and owners are advised to adhere to feeding recommendations to optimize their cat's outcomes. Diabetic remission potential. A major goal in treating feline diabetes is achieving remission, the state where the cat maintains normal blood glucose without insulin injections. Cats have a unique capacity for diabetic remission if interventions are started early and intensively. Approximately 30–50% of diabetic cats can go into remission with appropriate therapy. For instance, one clinical study reported a 47% remission rate in newly diagnosed cats managed with a rigorous protocol of twice-daily glargine insulin, home blood glucose monitoring, and a low-carbohydrate diet. Median time to remission was around 3 months in that study. Other studies and case series similarly find remission in a significant subset of cats, especially when strict glycemic control is maintained from the outset. Remission is more likely in cats that are treated with long-acting insulins like glargine or PZI, fed low-carb diets, and that avoid chronic steroid use or other factors that cause insulin resistance. It's important to note that even after remission, ongoing diet control and monitoring are needed, as around 1/3 of cats that achieve remission may relapse and require insulin again at some point. Still, the possibility of diabetic remission is a unique and encouraging aspect of feline diabetes management. Aggressive initial treatment can lead to the cat's pancreas recovering sufficient function to dispense with insulin therapy, at least for a time. Expert recommendations and innovations.